Hi, I'm Soha Ali Khan. Welcome. Imagine this, flakes falling every time you touch your hair, or your favorite black outfit turning into an embarrassment. Yes, I'm talking about dandruff, the silent villain on your scalp, feeding on oils and wrecking your confidence. You've tried it all, curd, lemon, oils, OTC shampoos, but it only gets worse. Well, don't panic because today we're uncovering the truth with insights from a dermatologist to guide you to a healthier scalp. So let's get started. Welcome, doctor, and thank you for joining us. So, doctor, many people think that dandruff is just dryness or a cosmetic issue. Is it really that simple?
Hi, this is Dr. Gunjan Gupta from Skin Concepts, Noida. Let me begin by clarifying dandruff is not caused by dryness of scalp. Technical name for dandruff is seborrheic dermatitis. Seborrheic coming from the word sebaceous gland, that is oil gland, and dermatitis is inflammation of the skin. So it's inflammation of the skin where oil glands are present in high density. It's caused because of overactivity of oil glands. There is overgrowth of a yeast called melassasia. This yeast then feeds upon the dead cells in oil. The secretions by the yeast cause inflammation, increasing cell turnover. And this in turn leads to the symptoms of dandruff like flaking, itching, etc. It is generally seen in areas where oil glands are present high density, like your scalp, beard, mustache, eyebrows, sides of the nose, ear canals, behind the ears, etc. And in males, it can be on the chest, upper back also.
Now that we've understood that it's not just dryness, doctor, please tell us when and why people suffering from dandruff should seek medical consultation.
Medical consultation. In mild cases, you could begin by increasing the frequency of a shampoo, reducing the use of hair oil, especially on the scalp. As we have already discussed, dandruff is not because of dryness, so using oil is not going to help you get rid of dandruff. You could use an OTC anti-dandruff shampoo or home remedies like nimbu, dahi, whatever is your choice. But in case all of these don't work and the scalp itch is uncomfortable, there is visible flaking on the scalp, or especially if it's extending beyond the scalp like your eyebrows, beard, behind the ears, etc., it is time to see your doctor. The doctor will give you medicines, lotions as well as shampoos which have higher concentration than the OTC products, which will give you immediate relief.
Doctor, why is it that most of the home remedies fail to treat dandruff? Why is dandruff so stubborn? And why do these quick fixes not work?
Several reasons behind stubborn dandruff. Why some people are more prone to dandruff is not clearly understood. Genetics have a role to play. If you have an oily scalp, you will remain prone to dandruff throughout your adult life. It generally begins around puberty when the hormones are at their peak, and then it will continue up to late middle age, on and off, depending upon several factors. If you're a male, you're more prone to dandruff. There are seasonal variations. Winters, dandruff is more common. Stress, pollution, hormonal imbalances, all of these add to the worsening of dandruff. If you're not shampooing regularly, you're using a lot of leave-in hair styling products, using a hair oil, especially on an oily scalp, all of this will lead to resistant dandruff. Also, in certain cases, rarely, and psychiatry medicine or neurological conditions like Parkinson's are also responsible for dandruff.
What is the key takeaway for managing dandruff?
Key takeaways: dandruff is not because of dryness of scalp. Oiling is not the answer. Oiling will only help you mask the dandruff for a short while. It will never help you get rid of dandruff. If you have oily scalp, tendency for dandruff is going to remain for years. You will need to learn to manage it with the help of your dermatologist. Dandruff does not cause any serious long-term problems. It is generally not associated with severe hair fall.
What should people do to maintain scalp health?
Maintaining good scalp health is not difficult. Regular shampooing. How frequently to shampoo your hair? It depends from person to person. The thumb rule is to shampoo the hair whenever the hair feels dirty. There is no set rule. If you have an oily scalp, make sure that you use a clarifying shampoo at least once in 10 days. Do not use very hot water to wash your scalp. In case you have an oily scalp, avoid applying hair oil on the scalp skin at least. If you must, you can apply hair oil along the length, half an hour to 1 hour before shampooing, not overnight. Avoid use of too many leave-in hair styling products. Make sure that you're not deficient in any vitamins, especially B complex, zinc, etc. your thyroid levels are normal, protein intake is adequate, that is all. Thank you.
So dandruff isn't just about flakes or itching. It signals underlying issues like seborrheic dermatitis and acne. Don't wait for dandruff to spiral out of control. Consult your dermatologist and find a solution individualized for your scalp. Your dermatologist knows best and will help you to stay flake-free and confident. Your scalp, your story. No shortcuts, just expert care.